My name is Virender Singh Anand. I became an orthopedic surgeon is because after I finished my college, I was looking whether to be an engineer or to be a doctor. And that time engineers were not doing very well. And I was talking and my uncle said, you know what, be a doctor because one of his son was a doctor and he says, that's a good profession. That inspired me to be a doctor. I'm an orthopedic surgeon. I treat patients who have an injury to the shoulder, the wrist, to their knee, hips, ankle. I take care of carpal tunnel, or the patients who have had rotator cuff tear or an ACL tear. What I enjoy the most is to see these patients when they come to the office with pain and discomfort, and then you evaluate them, you see them, and then after you finish treating them, you see that there's a relief, and the outcomes is what makes you feel happy. Generally, a typical day in the OR is when you get to the OR, see the patients before surgery, talk to the family, and then go ahead and finish the surgery, then go back and talk to the family and let them know what were my findings during surgery and what I expect. And then in a day, finish my surgeries, and by the time I'm done in the evening by 5 to 6, go back and see post-op and get back home. The best thing I like is that it is a hospital where things are a little more comfortable because everyone knows everyone and they're more social and there is more personalized relationship, where sometimes you find that the patients and the professionals right here in Pioneers Hospital, they almost know each other like at one-to-one level instead of being like Mr. or Mrs. When I see the patients with the knee problems, by the time they come to my office, by the time they've been treated, they've tried everything from Advil at home, using a brace, and now they're in pain, they come over, we repeat x-rays, we try to treat them conservatively. Then we do surgery and we love the outcome of them. And then you see patients who have had rotator cuff tear and they've got a shoulder problems, and you treat them conservatively and operate them and then see that how they can use the arm very well. I enjoy that the patients come to you with their complaints and then you get an opportunity to see them, talk to them. And it's like an investigator. You get into the discovery and find out what the problem is and then try to address the problem and take care of it.